have three main objectives, right? The first one is to learn the meaning of social distancing, a term that is being used a whole lot since the beginning of the year and probably before that. And the importance of practicing it during the present time. We're also going to learn the difference between social distancing and social disconnection, and provide strategies to deal with the emotional aftermath of being away from others. So we can begin everything, this presentation, like in context of what we're living. I saw this quote and it turned out to be quite interesting. And it says that a disaster, which originally meant ill starred or under a bad star, changes the world and our view of it. Our focus shifts and what matters shifts. So I think it in some way describes what we're probably feeling and have been feeling since the beginning of the year and this pandemic. So COVID-19, right, to begin with some important information, and Latinos families in the US, there are some areas we should explore a little bit more, right? And first of all, when we speak or we mention the socioeconomic barriers, they place them at an increased risk because of employment, housing. There's a higher rate of transmission among Latinos and Latinas ages 40 to 55. Children are also being diagnosed at higher rates with multisystem inflammatory syndrome, a serious disease that has been linked to COVID-19. And also because of the limited access to healthcare. And this data is as recent as this present year, 2020, or 2020, I mean. There's also educational barriers, and as we see, 27% of students in the United States in our schools are Latino or Latinas, right? 75% in K-12 schools are English learners, and caregivers have lower levels of education and may have a limited knowledge of the educational systems as it is ran in the United States. So there should be or we could find some more struggling when reading English, and therefore have more difficulties helping their children with the schoolwork. So to begin officially stating what is social distancing, okay? So if we search definitions of this term, it refers to the extent to which people experience a sense of familiarity, nearness and intimacy, or unfamiliarity, farness and difference between themselves and people belonging to different social, ethnic, occupational, and religious groups from their own. The CDC, the Center for Disease Control, in 2020 has defined social distancing they have also defined it as a physical distancing, meaning that we're keeping a safe space between ourselves and other people who are not from our household. And also, they have used social distancing as referring to a social or physical distancing and staying away the famous 6 feet or about 2 arms length from other people who are not from your household, both indoor and in outdoor spaces. So basically, social distancing has a difference between the people that live with you in your same household and people from outdoors or outside, I mean. So why is it important, or why are we practicing social distancing right now? So the main reason is because studies have showed that it helps to avoid the spreading of COVID-19. So when we keep our distance, probably we are in a better position from spreading what the virus is. We are also trying to stay safe, that we're trying to protect the vulnerable, and we know it could be children and it could be people over 60 years old and people with some medical condition, previous medical conditions. So we also practice social distancing because we're following rules. So in other words, we're trying to do what we are told to do. So here are some basic social distancing don'ts and do. So when we are practicing social distancing, we're not supposed to have large gatherings. And it doesn't matter if it's with our families or our friends or coworkers. It is not recommended to have gatherings at this time. Also, hugs are a don't. Going to gyms, and I have to clarify that these have been subject to new advances, right? So they can change from day to day as governments or officials have been given new instructions of what we can and can't do. But for now, we are not supposed to gather, hug, or have a very close distance connection with people, and also assist to movie theaters or closed spaces where a lot of people are gathered at. But what can we do? Because you will see through this presentation that focusing on the positive is a good way to deal with this social distancing. So we could have everything virtual, like this webinar. And sometimes I like to think that there are some things that we wouldn't have access to if it weren't for this social distancing. So we could have meetings, we could even have coffee breaks, exercise session, book clubs, and we could see online how many offers are being available to practice or to join different kinds of activities virtually. So how do we explain social distancing to children? And it's probably one of the most difficult things to do because children probably haven't developed, right, the reasoning needed to understand what is going on. Also, some of them may not have access to the information as us adults have. So the National Association of School Psychologists recommends, right, or states that children probably don't understand why parents or guardians aren't allowed them to be with friends. Tell your child that your family is following the guidelines of the CDC and explain what the CDC stands for. And the recommendations or guidance include social distancing. Social distancing means staying away from others until the
Can you
risk.
still hear it?
The
Can you
risk.
hear the webinar? No? Okay.
A little bit. Okay. So the guidelines include social distancing, which means, as we stated, staying away from others until the risk of contracting COVID-19 is under control. So we have learned and seen through the news and other media that the famous curve, which we're searching or seeking to flatten. So we can show these charts to our children because visual aids most of the time help explain what's going on. So if we tell our children this is the curve and we're trying to flatten it, it would help them add a little bit of significance to what's going on. Also, NAPS suggests to explain that while we don't know how long it would take, and it is okay to tell our children that we don't know some answers, we can reduce the number of people that are infected. So what we know is this is a critical time and that we must follow the guidelines of health experts to our part. Sometimes it's very productive or positive to let kids know that you don't have control of it either. So this is something they're telling us to do. So it's not only exclusive of children. You should also let them know, or you could also let them know that you also have to follow these guidelines and that you are practicing social distancing too. So that this is not something exclusive of them, or that we don't want them to go outside, or we don't want them to see their friends. So we will see along the presentation how can we separate what we can do versus what we can do. So as any crisis or trauma, but a different difficult moments, we have an emotional part that is also affected, and I've called it the emotional aftermath. So let's see how does social distancing affects us emotionally. First of all, we're gonna talk about what are emotions, and this is something that I'm gonna talk about here and mention to put us in context or to know what we're gonna be talking about later on. But if you see our three-part webinar, there's our second webinar is gonna be all about emotions. So you should connect and see more about that in our second webinar. But basically, emotion is defined as a complex reaction pattern involving experiential, behavioral, and physiological elements. So what does this mean? That emotions is not only what we feel. Emotions have a way of connecting with our behavioral and psychological aspects of a human being. So, and they also produce reactions. Basically, the main things we need to understand or know for now is that emotions are innate. So what this means is that they're automatically produced. So there are reaction to something that happens or something that we think or something that we see. So these reactions, people tend to confuse a lot, that we can stop feeling some way, and it's incorrect. Emotions are gonna be innate, so we are gonna feel them. Emotions are not classified as good or bad. They vary in intensity. There are some emotions that could be felt or experienced in a deeper intensity than others. And very, very important that emotions differ from actions. It is commonly seen that actions and emotions are confused. That's why sometimes people say that they're good or bad. And usually, when we will ask children, in my experience, what is a good emotion, they will answer happiness or excitement. And when we ask them what are bad emotions, they would answer typically anger and sadness. And this is because mostly by the reactions that we have uh, of those emotions. Sometimes when people are angry, they might break things, or they would say hurtful things, or they'll probably do something that is negative. So that's what really is not good at all, the reaction, not the emotion. The emotion is just an intense feeling that someone is having as a reaction to something else. So for example, emotions, I have some examples here. Like, for example, happy. Happy is an emotion that we experience a lot. And happiness, usually when we are happy or when people is happy, they laugh or they smile. When they are sad, they cry. When some people are angry, they could scream or throw things. When people are worried or feel worried, sometimes they bite nails, walk around, they tremble. When they're scared, people tend to tremble, to cry, and there are I don't know if you have had the experience of people saying, when I'm nervous, I start laughing, something that's usually not expected. But this comes to say, or as an example, that not everyone reacts the same way to a same emotion. So, excited. There's people that cry when they're excited. Excited. So that is their action. That's the way they can express it. Okay. There's people that jump, that scream, that talk a lot, and they keep repeating themselves. So the emotions are the same. Happiness is a same emotion throughout everyone, but the way we react to that emotion or what we do with that emotion, that may vary from person to person. What that means is that what we should judge, or what we should observe more, is the action, how a person reacts to the emotion. So if I am angry and I throw something at someone, what is negative is the action of throwing something. The negative is not being angry, because all of us have the right to feel whatever we need to feel. And we'll see that more in more detail in our next webinar next Tuesday. So when we are in practicing social distancing, there are some symptoms that are common among everyone, right? So this doesn't mean that we have to just observe these symptoms. My recommendation is that we observe anything that a person might be doing, saying, or not doing that is different from their normal selves. But what we mostly see through our private practice, or through consults, or through reading articles on the specific theme, is that some of the symptoms are isolation or lack of energy. So this means that people uh, close themselves off from other people. We can also see sadness, right? Because we are totally apart from people that we usually hug, or we usually go out with, or share many things. So it can produce sadness. People, or some people, can feel sensible. This means that the tiniest little comment or the tiniest little action can produce an intense reaction. Or if you see them in a way or look at them differently, they can feel sad, or they can cry. So the reaction sometimes is not as expected. People can also be or feel cranky, and that is okay. We are being we have been disconnected from what our usual routine is, or had been, right? So this can produce crankiness in some people, and in others anger, which can be a sum of a lot of frustration along the way. Okay? So it's very important for us in our different roles to recognize the expected reactions. This means that we should understand that there are symptoms, that are totally normal. What does this mean? I don't like using the word normal too much, but what normal means in this case is that we expect them. If, for example, if we have been quarantined for a month, we can be sad or cranky. What does this mean? That anyone who is closed off in a one-bedroom apartment, or probably in a house, any kind of house, without being able to go out, can feel sad or cranky. So this emotion or this reaction, when put into context, is totally expected. So it's very important to focus more on actions, because our feelings or our emotions are gonna be natural. So they're gonna be there. There's nothing we can do about it. But we can focus more on actions because we can control those. So we are going to try to see or to observe, how do I or others respond to being quarantined. Okay. And we can see it, sometimes with people that we are surrounded by. Now that we have the opportunity to see them more, and we have the time to observe versus just looking, we can see minor or major changes in their daily routines. And it's also important that we can focus on that when we see other people through the distance, or we speak to them, or there's some kind of connection, that we can catch those triggers or those things that we find as unusual. So here are some warning signs, and I like to emphasize that it could be different in other people. Okay, so this is what we mostly see as warning signs. The change in eating habits. So the change can be eating more or eating less. So both of them can be warning signs. Usually, eating more is associated to some type of worry or anxiety, and eating less can be associated, or normally is associated, to being sad or depressed. A constant bad humor, which I connect with being sensible. So when we're in a constant bad humor, which was not typically our usual behavior, that is a sign that probably the person is not dealing very well with their emotions, or what with the social distancing, or whatever that is happening in our surroundings. Isolation, when I stop calling people, or I want to stay in my room all the time, and I don't want to hear the news or watch any type of program, or I constantly lose contact with other people, that is a warning sign. Also, the lack of energy, because the lack of energy sometimes is related to not wanting to do something, or the loss of interest in things that were important to us prior to the social distance. The low tolerance, which can also be connected with the constant bad humor, and the sensibility. The negative or pessimist expressions, especially on people who before what we're living right now, were quite optimistic or neutral. So if we start, like, why should I even bother buying clothes if I'm not going to use it anymore? Why should I continue studying or connect to my classes if probably the world is ending? Some kinds of expressions that can be warning signs for us. And probably the most important of all is the mood changes. When we can observe in other people, from children to adults, that they're feeling, or they seem to be feeling one way now, and a couple of hours later, we can see a drastic change, from happiness to sad, from optimistic to pessimistic or negative, from high energy to low energy. Usually, these are very important warning signs. So, This is the part where I like to focus more, and it's recommendations. What can we do? What can we do for ourselves, for our family, but also for the people we are in contact with? So first of all, one of the main recommendations I give out and that I've read that is quite useful is to understand what things I can control versus the things I control. I usually use this two-circle image to explain it to my patients, the smaller ones and the older ones too, in which I draw these two circles, and usually, like in the image you're watching right now, use two different colors to separate them. So the center circle, which is smaller and it's white, it refers to the things I can control. So probably in this moment, if I give you probably a minute, you can think of things you can control. So when I think of things I can think of what I'm wearing, right? I went to my closet this morning and picked out this blouse. I can control what I eat depending of what I have available. I can control when I eat. I can control when I get up. Um, I can control my time. I can control what I watch, what I do. So there's a lot of things which I can control. So if I focus on those things, it could give me a sense of um, empowerment, right? So on the outside, the blue one in this case, I like to call it what I can't control. And those are the things which I don't, if even if I don't like, or even if I like a lot, I have no control over. For example, we were mentioning that the CDC had some guidelines which included social distancing. So that is something I cannot control. Okay? I don't like to be far away from the people I love, but I have to do it. There's nothing I can do about it right now. Why? Because it's a rule, or it is something that I have no say at, and which I could be punished if I don't follow. So it has consequences. So usually there's a lot of things that we can control which occupy a lot of our energy. For example, if we are driving to work and we run into a traffic jam, that is something I cannot control. So I can decide on complaining and battering myself because I'm going to be late to work. I'm spending all that time on the road. Why does these people have to do this at this time? Or I could just say, I can control this. Okay? This is something that is unexpected, so I'll just sit here and wait because I have no more options. When we deal or argue with things that we can control, we're using a lot of energy. And when we lose energy, the result sometimes is making us feel tired or angry for no reason at all. So these are examples of things I can control versus the things I have no control over. For example, I want to visit my parents, my families, my friends, but I can't risk their well-being. I want to celebrate my friend's special moment, but I can't participate in group or gatherings. I would love to travel abroad, but I can't put myself at risk. And the thing is, right, this is a recommendation because when we start looking at these things in a different way, we can see the difference between frustration and acceptance. For example, it is not that I don't want to visit my parents or my family or my friends. When I think, wow, I don't want to go to see my parents, the emotional burden that accompanies that is very, very strong. Versus if I separate that I want, I have all the good intention to go and visit them, but I can't because other people are giving me instructions which I have to follow. So frustration becomes acceptance. And acceptance is something we could deal with better than feeling frustrated. Very important. Sometimes we might have a lot of time available because the activities, the outdoor activities have been cut short. So following a schedule is very important and it is very useful. It might seem like something simple, but this can help you identify hours of operation, right? This is no other than identifying when you're going to be available for work, activities, friends, um, consults, whatever it is that you need to do. Also, if you assign activities for each hour, you
I think that it's gonna be the same because they didn't talk about the whole school day. So I think we should just double check the website because they said all their information's on.
Okay, so when we identify the hours and we assign activities for each hour, we have like a map that we can follow. So our mind works less. Our mind works less because we are not constantly thinking, oh my God, it's 2 o'clock. What am I going to do next? Versus if I go to my schedule and say, okay, 2 o'clock, I have a webinar, or I am going to connect to this live session, or I'm going to rest, or this is the me time. So it is, when we look at it this way, we are helping our brain not overwork. When our brain doesn't overwork, we feel better and it's energy that we don't waste. Planning ahead is very important because it gives you a sense of organization and it also gives you something to look forward to. If you plan a meeting, a virtual meeting with your friends, it's something you look forward to. And it gives you a sense that the future is there, that you can make plans, that there are things that you can schedule. Also, it is very important to include a variety of activities. And when I say activities for each hour, it doesn't mean that it has to be something formal. An example of an activity is a meal. So if you want to have your lunch break at 1 o'clock, you write it down. That is the time that I want to separate for lunch. And it is different from standing around and eating whatever you could grab. It is a time in which you disconnect from everything else and just focus on having your meal and enjoying that time. Your rest and naps could also be part of activities that you can schedule, and it seems like something fun or something that I am not able to nap or I'm not able to rest. When we have a schedule, we could see formally, right? We could have in black and white the time that we have, and we could see it, and then it's easier to distribute. Also, we should include activities for fun. It is very important that it all cannot be work or studying or doing things that require a lot of energy. You can also do fun things and you can include it in your schedule. And time for doing nothing at all. This is my nothing at all time. And that means that at that time that you have separated for this activity, you do whatever you want. And that is okay. So when we have a lot of members in a same household, we can have a group schedule. And sometimes it is it is recommended to have a space where we all get together. But it's also recommended that everyone in that household has a me time or a space for themselves. So how can we connect with others when there is this social distancing? Children can have, for example, virtual breaks between classes. We could find ways in which they can connect and eat the snack together, share what is their snack, what did they think about the class, or any other thing. It could be 5-10 minutes, but it means a lot. Um, Chats can be also another options, but always depending on the age, we should supervise what's going on. We could also plan to watch movies virtually, also play games virtually, write letters or emails, and to connect with other people. We could also have video calls and drive-throughs. Recently, one of my 15 or 16-year-old patients connected to our session and was very excited because she got to see her friends. And I asked her, but how did you do? And she said, we asked our parents to meet at this parking lot in a mall, and we all had a beach chair, and our cars were parked separately, and we all sat in front of our cars like in a circle, and there we started talking. It's the same thing we do virtually, but at least we got to see each other, and it gave her a sense of proximity. So adults can also have options for feeling that connection, and it could be virtual weekly meetings, which you can always also add to your schedule. So when it's in your schedule, it gives it a sense of formality too. It's like it gives you a sense that is something I have to do because I already wrote it down. So it gives you a sense of compromise. We could also have virtual book clubs, right? If we are also reading a book, we could also have the video calls or conference calls, the phone calls, and team meetings. We could also have our chats with our friends, groups according to our interests. Nothing replaces a good hug, right? But sometimes it's good to understand what we have so we can deal with that, right? And if we dwell too much on what we don't have or what we need and it's not obtainable, it gives us a sense of frustration, and it could make our emotions a little bit downhill, right? So emotions are very important, not only to recognize, but to validate. So we already said that emotions are expected and that our reactions that are going to appear according to the situations. So it's very important that when we're dealing with emotions, we recognize I am angry or I feel sad. I normally hear people, or I usually hear people say, no, I cannot be sad, or that won't make me angry. And sometimes it's a simple negative way in which we are viewing things or dealing with things. So it is important to say, I am angry. Okay, I am angry. I am not going to scream at them, or I'm not going to throw anything, or I'm not going to make a big deal about it. But I need to recognize anger, or I need to recognize my sadness. Okay, so this is very important because it is a natural reaction. So it's going to be there. Even if you don't pay attention to it, it's going to keep on bothering you. So once you say, and you recognize, I am angry, your anger is going to know that you paid attention. Also, when you validate your emotions, you're telling your emotion, okay, you are right. Okay, like, okay, sure, I have to be angry. Who wouldn't be angry? Anyone can feel sad at some time. So that is validation. That is letting know your emotion that it's okay, that it's there, that you're not going to act upon it right now, but that you recognize it. And also, it's a good recommendation to separate emotions from actions. What does it mean? I am sad, I recognize it, but I'm going to connect with my friends. Okay, I am sad, so I have options. Okay, I am sad. It's okay to be sad. So I can go and lay in bed, or I can just continue on. I am angry, but I'm going to fix a nice dinner. Okay. So the emotion is there. Okay. I remember when here in Puerto Rico, we went through the earthquake, and then the continued tremors through January through the other day, basically. And I used to tell people in webinars, okay, we are scared, and that is normal because we had never experienced this before. But we are scared, but we go to work, and we are scared and we go out to dinner. So the emotion can accompany us through our actions. So what is going to determine how well we manage things is the decisions we make upon acting to those emotions. Also focusing in the positive, right? So difficult moments always bring learning experiences. How is that possible? Yeah, many times it's in difficult moments where we get to know ourselves better, and we know what we're good at and what we are able to do, because most of the time we are not put in these situations. So we understand ourselves better, and we know what we are able to do. And it gives us the time to explore new hobbies too. So we can just focus on what we have versus what we need or don't have. So what is available to me? So once I understand what is available to me, physically and functionally speaking, what can I do with that? Okay. So if I say, yeah, I could go outside and sit for a while and disconnect, I would love to be at a beach somewhere, or probably in another country, but that's not possible. So if I focus on what I don't have, it always seems like a loss. So if I do the best that I can with what I have, it feels like more productive. Also, give yourself some credit for what you're doing, even the most simple thing. I connected my 3 kids on virtual learning, and everybody is doing okay. You give yourself a pat in the back. Why? Because we need to recognize what we're doing on a daily basis. We cannot add it up, because then it doesn't feel the same. The reinforcement has to be right after our actions. So give yourselves some credit and pass the word on to others that surround you. Give credit for what you are doing, and identify time for yourself. Okay, as I mentioned in the schedule, the me time is very important. It's okay to disconnect from phone, social media, other people, um, your regular chores. Okay, it's okay. Yeah, and all of us have that sense of when we need that. So if we schedule it in every day, we don't let things add up. So it's good to be consistent days and times. If you want to wake up half an hour before anyone else and have that me time, it's okay. It's okay to have that me time, because when we are doing okay, we can help others be okay too. So it's okay to be quiet. It's okay to do nothing at all. It's okay to have some time to reflect on your accomplishments and do something you love or enjoy. And finally, but not least important, it is important to ask for help. It's okay to ask for help. And it's important for you to know your available resources, family, that go-to person. the same with your friends. Who's the good listener? Who's the one that could come in or take over? Your coworkers, other parents, other peers, the peers, or identify support groups, people who are going to help you lift you up when you are down or when something's going on. Also, mental health professionals are the people that are trained to deal with this. So it's people that's not going to judge you and that's going to listen to what you need and are going to help you find a way to get back on track. Also, your main physician, if you visit them frequently or have a person to check your physical health, you can also ask for some recommendations. And there's always the crisis hotlines that are nationally and probably locally, which you should be able to identify and have it as an important resource. So when we're talking about policy and practice implications, for example, schools can do some things that can help or lower the impact of COVID-19 pandemic. For example, plan opening schools that serve Latino and Latino children for in-person learning. The funding is very important because there's a need for internet and good technology, good connections, because this is going to help our day-to-day functioning much better. Important to provide access to PPE or personal protective equipment, prioritize the sanitation, right? It's what we should focus on. The students' ratios can be lowered and provide sufficient material for individual students' access, and also offer flexible work and attendance options. Also, very important, the training, right? In person or online, um, instructional practices to support the language and academic needs. Also implement and expand the dual language education, which is very important. Ensure that teachers and staff proactively assess Latino students and families' technology access, support students' social economical needs via regular online or phone check-ins. We need to know how people are doing, right? Our communities are doing. And also employ bilingual and bicultural social workers and school psychologists as part of our resources, of the resources available for school communities. Very important, the mental health services that should be available for students and teachers to be evidence-based, culturally and linguistically appropriate, and trauma-informed, school-based. Also, ensure children have access to free meal programs during school closures. We know this is something very, very important and needed in many communities. So basically, this is the end of our webinar. I would like to know if there are any questions or any doubts regarding our topic for today.
Hello, I want to remind the audience that you can send your questions to the question spot we have, and we can relay them to the presenter, Dr. Landers. Thank you.
While we give the space for the questions, I would like to acknowledge there are some references at the end of the presentations. The handout is going to be available or it's already available for you. So you're going to see there are some of them from the National Association of School Psychologists, or as we know them, NASP. which has a lot of resources in which you can access to online for information or more recommendations or references regarding what we are going through and other topics.
We have a bunch of comments about the presentation. Thank you, saying thank you for such a great presentation and the information, and that it's good to know this information in the current state, living with COVID. Also, saying yes to the biculturally and bilingual social workers at the schools, that they really like your visual about control, and that the presentation was well explained. And we have here, it says, I like to differentiate between comfortable and uncomfortable, especially when it comes to asking students, how does it feel in their body? Do you have any comment about that?
Yeah, that's a very interesting question. I don't understand if it's in something specifically, but when we ask children, we shouldn't be afraid to ask. Sometimes we think that children won't understand, but we can go straight forward with a question. But with children, it's also uh, good to include a visual which we could refer to, right? If we're talking of comfortable and uncomfortable, we could probably include an image of comfortable in many ways, or 2 or 3 ways that a child can identify that something is comfortable and uncomfortable. Also, it could be situations, or it could be reactions associated with being comfortable and uncomfortable, and we could provide those visual aids together with the question. So the children can match the word to an image or to something that they know. If they don't know the word comfortable or what it means, it's going to be very difficult for them to do the research, right? The inside research of trying to find an answer. So when we are asking questions to children, it's very useful to have a visual support. Like I said, it could be an image, it could be reactions, it could be expressions, and we could have those 2 options and have them identify which one of them. I don't know if it answers the question, but it's one of my main recommendations always with children, and try to use or neutral representations, or try to use you could use uh, characters, right? Famous characters that we have from series, from games, from things they like, and it's gonna be something that it's easier for them to identify with.
Okay, we have a couple more questions, but first I want to make a comment about something we're getting. People is asking about the Spanish, the presentation in Spanish, and we do have dates, and we're going to say the dates for the Spanish sessions in a couple of minutes, okay? For now, we're going to share more questions with you if that's all right.
Yes, it
We
is.
have another. It says, can you share with us some recommendations about when is the time for parents to seek for professional support? What kind of signs we should be looking for?
That's also a very important question. As parents, we sometimes parents are the go-to person or the closest person to children. So when we talked about the warning signs, it also applies to children. But in children, we need sometimes to give them some space. When what I mean by space is that we need for them to be angry and to be sad and to worry, because these are expected reactions to what we're living. As parents or caregivers, we always tend to want to protect and to make everyone feel better, but there are some experiences that children need to go through. So sometimes if we see a child that is sad, we probably worry and think uh, the child needs help immediately. Not necessarily. So my answer to your question is, if we see changes and the mood changes that are consistently, right? If this happens one time during the week, I'll just add it up but leave it there. But if we see that there's a constant mood change, if we see that our child is not acting as usual for several days, right? If we see acting out like changes in their behavior, that's one of the warning signs in children. When sometimes I interview parents and they say he's not usually this way. That is the things we are looking for. When this is something that becomes constant and becomes totally different from this child, is when we should act upon it. And also, first of all, we need to ask the child first, right? Is there what's going on? Open questions. I've noticed that you're a little bit upset. Is there some, what is going on? Is there something you need to ask me? And try to get information from the child. For them, it's going to be very difficult to express. Another thing that is very important is that children need for someone else to figure out what's going on with them, so they can seek help for them. So it's not like the adults that I'm not feeling well, so I call my therapist or I call my doctor. Children depend on their caregivers to observe this. So the observation is very important. And if we see that this is something that continues to be an issue and it's not resolved, we need to seek for help.
Thank you, Dr. Landers. We have another one that says, how does social distancing affect the Latinx student in particular?
Yeah, it affects them in particular because usually Latinx children, what it's usual is that they're close-knit families and sociable kids, okay, that are used to probably gatherings or sticking together. And this is a very important component of their daily living skills, the interpersonal relationships and being social. So when not only Latinx children, but children with this particular type of personality of being outgoing, of needing others, of being used to be in groups or sticking together. It's social distancing is going to be tougher on them, and that's why in a way we need to be creative with what we have. We have to match that experience or that interpersonal interaction the best way possible. So probably I will recommend, instead of virtual meetings, maybe across the street meetings or with keeping the social distancing and having something in common, but so that they can experience that proximity, following the guidelines, safety guidelines the best possible, but trying to make it more personal, right? More tailor-made for Latinx children.
Thank you so much. We have great presentation. Thank you. What is the best way to approach a child when they are angry or mad?
When they are angry or mad, first of all, we need to clarify what they're feeling, right? Because literature says that we make great mistakes by stating emotions in children that they're not really feeling. So it is very important to understand if it's really anger, or is it frustration, or it is tiredness, or what really is. But before we can do that, we need to give them a space. We need to give them a space, and we have to observe that they don't harm themselves or harm others. Okay, so it's okay, and let them know it's okay what you're feeling. Like, work it out. You have like it's like a kind of timeout, but it's not a punishment. It's a space to breathe. So we need to, when children are feeling this way, or we observe that children are feeling this way, we need to let them know, okay, we acknowledge that something is going on, and we let them know, okay, I'm going to give you your time. So you give your time and let them lower their emotions, right? The intensity. And then, but it's also very important to have the talk, right? And now, can you let me know what's going on? Their faces, right? Now with technology, we have access to so many things. So we can just go online and search for, or in your phones, for emotions, and with the smiley faces and the angry faces, okay, show me what were you feeling, because sometimes these emotions are very intense and they don't know the names. Okay, they don't know that when they feel their heart, like racing, and they feel like their hands are sweating, they don't know that is called angry. So we need to help them, and we could look up for an angry child, and what are you feeling, so they can identify it. And once that's there, we need to let them know that feeling that way is okay, that feeling with that way is okay, that when they need that space, they should ask for it. And then it is important to let them know that actions are different to what they're feeling. It's okay for you to be angry. It's not okay to scream at mom or dad or grandma. So it's okay to be angry, but you cannot throw anything, any object, because it could help other people. It could hurt, sorry, other people.
Okay, we have a personal experience that may be aligned to this that you are now saying, to this other question. I'm going to read it, and maybe it goes in the same line, but it has a difference. It says that she has a 7-year-old daughter, and that the daughter is very mad all the time. But when she asks the daughter, she says that she doesn't have anything. So I guess maybe it goes in the line that you were explaining, that children don't know what are they feeling. Maybe you can go further on that explanation.
Yeah, that's a very good example. I have someone near me, near to my family, who's going through that. It depends. It probably has to do because the facial expression and the way they behave can give us a clue, or it can make us believe that it's anger, and probably it's not anger. So that's a good point. We need to address what is going on. And second, the age is very important because sometimes it could be part of their development and the stage that they're going through, especially if they're girls. Um, it could be sometimes they say, I'm feeling this way and I don't know why, or I cry and I don't know why. So we need to know in which developmental stage they are, because probably there are changes they're going through that affect their mood state. So that's very important. Second of all, as you said, it's very important to place, show them an array of emotions, right? Probably the basic ones, and have them point out which one seems to be closest to what they're feeling. There are also instructive videos online in which you can, well, show them to them and let them know. And sometimes children will open up and say, that's what I'm feeling, or I don't have an explanation, or it's that I have a lot of work, or it is that I'm tired. So it's not necessarily anger. Anger also is a manifestation of something that's going on. It's usually linked to when children cannot express themselves, something that is bothering them, something that has happened to them and they don't know how to express it. And it doesn't have to be something very bad. It could be a bad experience at school, a bad day at school, or it could be someone said something that hurt them, or they're seeing something and don't understand it and they're trying to explain it to themselves. So anger is one of the key emotions that lets us know that something's going on. It doesn't have to be something real bad. It could be the simplest of things, but anger is an emotion that we have to pay attention, and we need to get children to express themselves. If we cannot do it on ourselves, that's the time when we need someone to help our children express themselves.
Thank you so much for that explanation, Doctor. We don't have any more questions at the moment. So Isa, if you're there and you wanna give the information that we were reserving for the end and the Spanish session dates. Sorry, I'm trying to unmute the other person in the staff. So bear with me for a second. Technology sometimes takes a little bit of work. There you go, Isa. Let's see if we can hear you now.
Yes, thank you very much, Anne-Marie, and thank you, Dr. Landers, for such an informative presentation. So also we want to let you know that we have part 2 and part 3. The part 2 is going to be on September 22nd, and the part 3 is going to be on September 29th. And we encourage you to be on this series. And also, we want to let you all know that we're going to have this presentation in Spanish too. So the first one is going to be October 13, October 20th, and October 27th. We don't have it already, the link on our website, but soon we're going to have it, and then you could be part of this. So on the next slide, during this month, right, September 15 until October 15, we're celebrating the Hispanic Heritage Month. And this is our banner that we're gonna be posting on our social media and also our website. We dedicate the Hispanic Heritage Month to our agricultural workers. promoting cultural responsive mental health services for Latino agricultural workers who bring food to our table. Celebrating this month, we have two upcoming webinars. On September 17, the intersection of racism, discrimination, and mental health in communities of color. It will be presented with the collaboration of the Hispanic and Latino Addiction Technology Transfer Center. And October 2nd, we have the evolution of Latino identities and mental health that will be presented by our trainer and content specialist, that is Arabic, and also Dr. Mark Hugo Lopez from the Pew Research Center. So you cannot miss those webinars. Thank you very much to all of our participants to be here and to supporting us with these webinars and trainings. Thank you very much, everyone.